Okay, so I chose prompt 1, which goes over depolarization and heart failure. And first I wanted to go over what depolarization actually is. So in the cell, your resting membrane potential is going to be negative 90 millivolts. Depolarization basically means that you're making this more positive. In order to make that happen, you're going to have sodium come into the cell and potassium move out of the cell. This makes it more positive, so it can generate an action potential. Basically, this signal travels down, and whenever it gets to the heart, it'll go to the SA node, which is basically the heart's pacemaker. Now, how it gets to the rest of the atrium is in your cardiomyocytes, there is things called intercalated discs, which basically take that signal and integrate it down into the whole atrium. And it takes it from this corner all the way across. So the intercalated disc take that signal all the way down until it reaches the inert layer and then the AV node. The AV node will delay it, which is called AV nodal delay, so that the atrium can finish fully contracting and pushing the blood into the ventricles. Once that's done, the signal will then travel down the left and right bundle branches, called bundle of His, into the Purkinje fibers. And these Purkinje fibers is what makes the ventricles contract and then push the blood out of the heart. Now, heart failure occurs when the heart is unable to supply enough blood to the rest of the body. And there's two different types. So there's HFrEF, which is heart failure with reduced ejection fraction. This happens at the systolic part of contraction. Systolic meaning that it is when the ventricles contract. So this part over here where the ventricles push the blood out, there's some sort of issue here. This causes a decrease in the Frank-Starling mechanism, which basically means bigger the stretch, the greater the squeeze and everything to push the blood out. So there's going to be a decrease in that, meaning that there's going to also be a decrease in stroke volume, but an increase in preload. And then you have the other kind, which is HFpEF, which stands for heart failure with pressure ejection fraction. This happens at the diastolic part. And basically diastolic means that it has impaired ventricular filling. So this here, whenever it happens here, something is going wrong where the ventricles aren't fully filling correctly with the blood. This can be caused by a decrease in ventricular compliance. And this basically can also cause a decrease in end-diastolic volume, meaning that you're going to have an increase or a decrease in preload. End-diastolic volume basically means how much volume is in the ventricles at the end of the diastolic period. So if you have less, your preload is going to decrease. And then it's also going to impair your lusitropy. So lusitropy is the resting period for your heart. So having an impaired resting period can really mess with the heart overall. So how can we use imaging to kind of help us whenever we're discussing, how to find where the issue is in the heart? So a PET scan uses radiation to unmask potential cardioischemias. And it looks at the heart, specifically the left ventricle, whenever you're exercising. So response in left ventricle in exercise. And also identifies regions of impaired perfusion, which that also is what the nuclear stress test does. So I'm just going to write it down here because there's more space. And then you have a cardiac score, which is a CT scan for the heart, and that basically looks for atherosclerotic plaques. Basically, that means that you have blood vessels that are blocked due to plaques. So overall, these are used to kind of tell where the issue in the heart is happening. So is it happening on the diastolic part, on the systolic part? That is where these come into play to kind of best let physicians know what kind of surgeries the patient needs or what kind of drugs the patient needs in order to help them avoid heart failure. Okay, so I also did essay prompt 2, going over the Wigger's diagram and how atherosclerosis can affect all of this. So this is the Wigger's diagram, and it shows the pressure changes at various stages of contraction on the left side of the heart as a function of time. So pressure, time, as it goes on. At the very bottom here, you have the electrocardiogram, which has your P, Q, R, and S, T, and that is labeled here. So your P wave represents atrial depolarization. This is whenever your atrium, so that top half of your heart here, depolarizes and has a signal going through. Your QRS complex is the next part, and that's going to have your ventricular depolarization and your atrial repolarization. So your ventricles are then going to depolarize, and while that's happening, your atrium is going to repolarize. Repolarizing meaning that it becomes more negative once again, because like we went over from the previous essay prompt, depolarizing means that you're getting more positive. Repolarizing means that you're getting more negative. And then the last one, you have your T, which is going to be your ventricular repolarization. Repolarization happens to basically kind of prepare the atrium and the ventricle to kind of contract once again. And so here it is over here. So first you have your P, your atrium depolarizes, pushes the blood, and then your ventricles depolarize, they push the blood, and then your atrium repolarizes, and then your ventricles repolarize here in the T. So it's just pretty basic little heart sign. So going over to the Wiggers, it has several different lines besides the electrocardiogram, including ventricular volume, basically meaning how much blood is in the ventricles, ventricular pressure, how much pressure is in the ventricles, and atrial pressure, how much pressure is in the atrium, and the aortic pressure. Aortic pressure can also be known as afterload. Afterload is basically blood that sits on top of the aortic valve, and having a higher afterload is going to decrease your stroke volume because it makes some sort of resistance whenever you're pushing blood out of the heart. So there's 7 different stages to the Wigger's diagram. Stage 1 is atrial depolarization and an atrial systolic contraction. This basically means that your AV valve is going to open and your aortic and pulmonary valves are going to be closed. So this is whenever the blood leaves the atrium and kind of goes into the ventricles. This is part of the systolic contraction. I marked all of them so they're able to be seen as to which part of contraction each one of these things is happening in. So your isovolumetric contraction is step 2. This is this little tiny sliver right here of space when all of the valves are closed. Volume is not changing here, hence isovolumetric, basically meaning doesn't change. However, the pressure increases, as you can see by this blue line here. Once the ventricular pressure surpasses the pressure of afterload or aortic pressure, the aortic valve is going to open and rapid ejection is going to happen. The aortic valve is going to remain open until afterload, the aortic pressure once again surpasses ventricular pressure. After that point, the aortic valve is going to close again, and then you're going to go into isovolumetric relaxation. This step here, reduced ejection, is basically just getting the rest of the blood out. The aortic valve is still open. But once that aortic valve closes, isovolumetric relaxation, which is the same as contraction. Instead of getting ready to contract, you're relaxing. So aortic and mitral valves are closed. So your next is going to be rapid filling. Rapid filling, your AV valves are once again going to open. This is basically just starting to reset the whole process again and filling with blood. So atherosclerosis is the buildup of fats or other substances in or on artery walls. So you can think of it like this. This is a blood vessel, a normal blood vessel. When you have a buildup of plaques, it makes blood have some sort of issue getting passed. So if blood cannot pass as easily, you're going to have an increase in your blood pressure. So atherosclerosis causes an increase in blood pressure as well as an increase in heart rate. Basically meaning that this atherosclerosis has a direct relationship with hypertension, which is what this is. So all of this is very much connected. When you have atherosclerosis, the Weger's diagram is not going to look the same. This is a reflection of normal heart function. Atherosclerosis can, like I said, cause hypertension, which is why drugs such as beta blockers, which are in charge of lowering your heart rate and your blood volume, are used whenever this is present. Hypertension is not something that anybody wants. It can lead to having heart attacks or heart failure. So beta blockers are meant to lower the heart rate and blood pressure in order to counteract, or at least try to counteract, the effects of having atherosclerosis in the blood vessels, which means that all of this is going to essentially increase. Your blood pressure is going to increase. All of this is going to increase, especially on your afterload, because that backup of blood sitting on the aorta is going to increase.